Are people aware of these little wars that go on within professions? I really like to know if anyone's aware of this. For example, optometrists versus ophthalmologists, paralegals versus lawyers, dental hygienists versus dentists, PAs and NPs versus physicians. I mean, the list goes on, and it really comes down to an issue with scope of practice. So the argument goes, this industry is really strained. There are clients or customers or patients who can't get in to see these professionals. Let me give you a little background. So every profession is actually regulated if it requires a license. So the Board of Medicine or Department of Health may regulate physicians, for example, and they have a particular standard. They have a particular level of education that you have to meet. You have particular exams that you have to do. And so in order to say that you practice that profession, you need to meet those standards. And so you can't say it's actually illegal to practice medicine without a license. So not anybody can just practice it. It's actually law that you can't do that. So what they're trying to do is change the laws so that more people can get in. And the argument goes like this: we can't get in to see this doctor. So and this is a very big issue for our country or our culture, our society, and we need to get more people in because we have a mental health crisis. So let's have more people provide mental health treatment. And so what happens is that you have the people who are traditionally providing that treatment saying this is a quality of care issue. And this is like the same exact argument that happens across industries. They say it's a quality of care issue if you let people with lower standards and less education be providing this same service that other people, require higher levels of education to do. It really is a trade-off, and it makes a lot of people upset because the people who are trying to get in, who are on the outside, they don't understand why they're not allowed to do it, and they see a lot of benefit to potentially allowing this service to happen, and they don't understand why this isn't allowed. But there's actually a lot of money and financial issues and financial incentive that's driving this battle, because the people on the in want to protect their profession, and it is more lucrative to have a profession that's highly desirable. And the people on the outside, they didn't pay as much money for those years and years of education, and so they see that these services as being highly profitable services that they want to get in the in on and they want to do. So it's very fascinating, and this has been going on for a while, but it's actually gaining a lot more momentum. And one area that I think people are going to start to hear more about is in this field of coaching. And coaching is something I've been talking a lot about more because I've just come across a lot of coaches on social media that basically portray themselves to be doing therapy, but they don't call it therapy, because if you say you're doing therapy, that would be illegal. And they say that they promote, they help optimism and clarity and relationships and positivity, and help people out of crises and stress management. And that's exactly what a therapist would do, but they don't call themselves a therapist, but they're marketing to people who have these issues, which is the same type of clientele as who a therapist would be attracting. And therapists are not happy about that. And it's going to continue to be an issue.